you just can't have your cake and eat it too. You can't be an injector and not be able to solve the complications of injecting, right? You can't laser someone's skin and not be able to deal with the blister, the burn, or the hyperpigmentation that you might cause with that device.
Hi, skin friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have another procedural dermatologist on with me, Dr. Heather Rogers. I love the content she's putting out on social media. It really speaks to me and sort of that no-nonsense education, real information, which you know I am all about here on The Skin Reel. So I am so excited to kind of pick her brain about procedures, right? You cannot turn on the TV, the internet, your social media feed without hearing about a new procedure or what procedure some celebrity has been doing. And I get patients coming in all the time or asking me questions. What procedure do I need? What should I do? It can be super, super overwhelming. And the first thing I say to people is, well, first of all, you need to figure out what bothers you, right? Because if nothing bothers you, then you don't need to do anything. So I love that we're going to be taking a deep dive into procedures and how to know what's right for you, how to pick the right provider to do the procedure for you, and then some of the things you can expect after the procedure. Now, Dr. Heather Rogers, she is a double board certified dermatologist, dermatologic surgeon. She has her own practice in Seattle called Modern Dermatology, and she also has her own skincare line. And she's very active on social media, really putting out great educational skincare content. So definitely check her out if you haven't already. She is a Stanford trained, and I know that her loyal followers really appreciate her unbiased candor and real world experience. And she has a ton of clinical experience as well. So if you were thinking about procedures, curious about them, maybe wondering if they are right for you, you are not going to want to miss this episode. Dr. Rogers, thank you so much for being here. I've really been looking forward to this episode because I feel like our message to our viewers, to our patients is so in alignment, and I'm really looking forward to chatting with you today. So thank you so much for being here.
Thank you for having me. I'm Dr. Heather Rogers. So much like you, I'm a double board certified dermatologist. I practice in Seattle. My practice is primarily skin cancer surgery and procedures, cosmetically oriented. I own my practice with my partner, Dr. James Collier, and I did 2 fellowships, one in Mohs surgery and one in cosmetics. And I also have a skincare line called Dr. Rogers Skincare.
That's awesome. Well, so I know we're going to talk today about procedures because that's a huge part of what we do. And my practice is very much like yours, a lot of skin cancer, a lot of procedures, do a lot of surgery. And even just today, I had a lady come in wanting a consult, and she felt like she was already behind the 8 ball because she was 48, she hadn't done anything, and all her friends had, and she didn't even really know what she wanted. She just felt like she needed a procedure. So do you ever have people who come in like that?
Yes, I think FOMO is real. I think how much time we're spending looking at our faces, doing things like this isn't actually good for the soul. And it happens a lot. And I feel like our job as good doctors is to help people understand what's fixable, what isn't fixable. You're never too late. What one person finds beautiful on their skin, which is their smile lines or their sunspots, another person might hate. So we have to sort of understand what is bothering the patient. And then maybe help them understand it when they come in. They're like, I should be doing something. You're like, okay, but why? Like, it's okay to be beautiful and do nothing. So usually those people come in for a reason. If you get to the bottom of what the reason is, then you can do a better job helping them reach their goals.
Yeah. So how do you approach that when someone comes in? Yeah. I mean, I know what I usually do is I hand them a mirror and I say, well, what bothers you, right? Because if nothing bothers you, you don't need to do anything. But
Exactly.
if something bothers you, and also I want to hear them put in their own words what bothers them when they're actually looking in the mirror, not what their friend, might think bothers them, but when they look in the mirror, what do they see that bothers them? And if it's nothing, then, we can just talk about sun protection, maybe a skin check. But I like to hear it in their own words. So I'd love to hear how you approach that.
I agree. I think that people vary, but in general, there is something. It's a hurdle to come see a dermatologist, and we both have long wait lists. Like there was some reason that made them come in, and the goal is to make them comfortable enough to be able to articulate that. And then once I have a starting point, then you get a pretty quick feel on sort of how educated they are. And are they educated because they've done a lot of procedures? Are they educated because they've done a lot of research? Or are they really new to this game? And I think the combination of understanding what brought them in, and so their level of entry level sort of knowledge about things, really makes it easier for me to speak in their language, to understand where I need to start with them. And in general, I don't want people to laser if they aren't taking good care of their skin at home. Like, there's just no reason to sort of jump to a more advanced step until you're doing the things before that. And like you've articulated on previous podcasts, if you don't need it, don't do it. So it's like, how do we get them to a point? I like to do as little as I can so that the patient is happy. And if the patient's happy, then that's where we hold. Oftentimes what happens is you get started and you fix something and then you've opened Pandora's box and then they're like, oh, okay, you fix that. Now can you fix this? Oh, you fix that. Now can you fix this? And you're like, okay, and we can go down that road. But it's nice to start slow. No, don't put your foot on the gas in the beginning and really sort of get to understand the person and what their goals are.
Make sure you have a good skincare regimen to begin with. And that does not mean complicated and expensive, right? But if you're not sun protecting, why go spend the money and the time to get a CO2 laser or intense chemical peel if you're not going to protect your investment? So yeah, I mean, I think just getting basic skincare, good skincare for whatever stage of life you're in is so crucial. And that's really like number 1, 2, and 3, right? And then we can go from there. And a lot of times just getting your complexion more even and uniform, fixing acne, whatever it is, that makes such a huge difference. And I love to just kind of start with that as well. And yeah, definitely kind of dip your toe in, try something that's maybe not permanent or surgical in the beginning so that you're not overwhelmed. And I like to think of my patients and myself having a relationship, right? I don't want to just see them one time and never see them again. Really want to like grow with them, have that long-term relationship, because skin is not always a quick fix. In fact, it usually isn't, right? It usually takes time.
As we age, our problems change, right? You have acne and you have oil, and then your skin gets sort of more dry and sensitive, and then you lose your estrogen. And so there is different tools we use all along that way. And I'm old enough where I've been taking care of people for 20 years, and I've seen a lot of people through these transitions. And that's fun. It's fun to be a resource for them. It's fun to be able to tailor. And as you get to know skin, you're like, oh, this person's got good skin, I got to crank the laser. Or this person has really, really weak skin, I got to turn down the laser. And so I do think people get better outcomes when they're working with a provider who really knows and loves them as a person and the way their skin behaves. But also people need to understand that I think on social media, there's this concept of what we do as, like, you and I are, we've had 13 years of training after high school. What we do is not something that you want to get done at a Doc in the Box or a Medi-Spa. Like, these are big commitment procedures. And I think oftentimes this perception on social media is that, oh, I just snap my fingers and all of a sudden all my brown spots are gone, or my wrinkles are gone, or my lips are perfect. But it's not. There's so much that goes into that, and it's very rarely a single one and done experience. And so it is making sure that the person who's in your exam room understands what expectations are reasonable. Where, like, okay, if you don't like your jowls, and who likes their jowls, right? That's a lower facelift, or it's Sculptra or some sort of volumizer, M-Face. There's all of these steps that have to go through it to really give them that tightened jawline that they think everyone has on social media. And so it's kind of pulling the curtain back and saying, let's have an honest conversation, because what you're seeing out there is not the whole truth.
Yeah, gosh, there's so many things I want to delve into with that. But yeah, just the what we're seeing is so not reality so much of the time, with filters, with everything, right? I mean, photoshopping and all of that. And it's unfortunate because when we see it, it's hard not to think that that's real, that's reality. And then it gives us kind of a warped sense of how we look, because when you see yourself looking natural, it can be like, oh my gosh, I don't have that glass skin or poreless skin, which is not, that's not real. It's manufactured, it's filtered, it's fake. But it's hard when you see that all the time and you think that's real. it's hard to have self-confidence with all of that. But also, I love how you were talking about procedures. And I think sometimes people think, oh, a procedure, it's, a monkey could do it, right? You just click on the computer screen, the device tells you what settings to use, and you just click, click, click. How hard can that be? Or Botox, you follow the pattern. And that's where I think people run into trouble when you are seeing someone who treats it as paint by numbers, right? Okay, paint by numbers are not masterpieces. Those aren't going to be put up in a museum, right? There really is an art to this. Yes, could a monkey type in and do the clicking and all that? Yes, but are you going to really get great results with that? No. And unfortunately, we see complications with that. So can you just share a little bit about like, how do you know if you're seeing someone who really has a training and expertise?
I think I always tell patients and on social media, you want the person who is doing the procedure to be able to get you out of any trouble you might get in from the procedure. So the thing that we all lose sleep over is fillers and blocked blood vessels, right? Like this is happens somewhere between 1 in 1,000 and 1 in 5,000 syringes. So it's not all the time, but it's not uncommon. And so I talk about that before I ever put filler in anyone's face. The first time we have a consultation, I'm like, there is a risk associated with hyaluronic acid fillers. It could get into your blood vessel. That is the reason why I pay thousands and thousands of dollars to have the reversal agent in my office, right? And it's not cheap to have it, but we have it and we have a lot of it, as I'm sure you do, because we want to be able to fix any problem that we start. We have a protocol. We have an ocular plastic surgeon on call. God forbid it gets into the eye. But there are these things where you just can't have your cake and eat it too. You can't be an injector and not be able to solve the complications of injecting, right? You can't laser someone's skin and not be able to deal with the blister, the burn, or the hyperpigmentation that you might cause with that device. And unfortunately, a large percentage of the people doing these procedures are not trained in the complications, or not trained in the skin, or not trained. They're like, oh, this is an easy way to make money. And it's not. It's actually a hard gig. These are people's faces, and you do not want to mess them up. And it is not for the faint of heart. Like this is not, and this is our joke in our office. We have 5 doctors and I'm the proceduralist, and I don't do as big of procedures as you do, but the other doctors have no interest in doing what I'm doing. Ellacor is scary to them. Filler off label is scary to them. And it does allow you to have some amazing results, but you got to do your homework and you got to be prepared and you got to be able to deal with it. And there's a small group of us who have that ability. And you want to vet people. The bigger the procedure, the more confident you want to be that this person has done it 100 times, has had a complication, and has seen somebody through the complication. Complications are not in themselves a bad thing. If you've done something a lot, there will be complications. But having held that patient's hand through it, as a patient still a patient of yours, and do they still trust you? Like, I think that's actually the most powerful thing.
Such great information there. Yeah, complications happen, right? No one is infallible. We all have complications, but with excellent training, you know which patients to treat and who not to treat. You know the settings and how to adjust that appropriately, not just counting on that computer screen to tell you. And knowing your anatomy. I mean, I'm shocked the number of people who do filler in states that are not even required to be at all trained in healthcare, and either nurses, doctors, whatever. But I, even as a dermatologist who does surgery and all that, like, just to your point, like I think about this. It's not something that I don't think about when I'm doing filler, because it is a real risk. Now, thankfully it's rare, but it can happen. So yeah, knowing how to manage that complication is so key. And I see so many patients coming in who have had a complication elsewhere, and the person there didn't know how to manage it. And so now they're coming to me. And a lot of times it could have been fixed a lot faster and earlier if they knew how to manage that complication. So yeah, like actually just this weekend, I got a picture from a friend of a friend of a friend who was the doctor, on the med spa, but really had no aesthetic experience. And they weren't even doing the treatment, but the patient developed horrible burn. And now they're like asking me how to treat that. So yeah, it's important to know not just how to use the device and who to use the device on or the procedure, but what to do in a complication. And even Botox, right? Even filler can have complications. Botox, you can get a droop. Now, I mean, it's not forever, but I don't want to walk around with like my lid half closed for 3 months, right? So I think sometimes people think, oh, it's no big deal. It's not surgery, right? What really can happen? But these things do happen. So I think it's important to remember these still are like medical procedures. I mean, they're cosmetic. But I also think in the cosmetic world too, there's really no error for a complication, right? Like they're coming in to look better. So they get scarred. That's not better, right?
No. And I think the listeners need to know that even if your injector is amazing, even if they have trained everywhere and done it 1,000 times, people's muscle anatomy is varied, right? So you can look at their muscles, you can be like, okay, this is the pattern. I'm injecting deep, I'm injecting superficial, like be all perfectly trained and still not get the most perfect outcome. And that is part of learning people's faces. And like this is one of the reasons why I don't like people flying to see me for like Botox, right? Because I actually want to see them 2 weeks later to make sure it's perfect, particularly the first time I meet them. It's just one of these things where you can inject the same amount of the neuromodulator in the same place and it can migrate a little bit different. So there are these things that are just left up to fate and it's not anyone's fault. And that's why you want to have a relationship with your partner. We don't want you walking around with a heavy brow. We don't want you walking around with a spocked eyebrow. And if you can see the person, no, like 1 in 100 people come back for a Botox touch-up. Like that is normal. That is what is supposed to happen. And that doesn't mean that your provider did a bad job. It just means that your face is tricky. My face is horribly tricky. No one wants to touch me besides me. I have to do all of my own injections because things go awry really quickly. And so you want your injector to do as little as they can to get the result that you want. You can always come back for more. There's sort of two different things there is like what we're talking about, appropriate expectations, right? What can happen? It's okay to communicate with your doctor afterwards. It's not like it's going to be this magical visit and then boom, it's over. And if your provider, be it a doctor or a nurse injector, won't hear what you have to say after that first interaction, that's a red flag, right? And then also when you first come in, like ask for before and afters. Ask the person how many times they've done this procedure. I think, slow the roll. Like if you walk in and someone's like, oh, you need 6 syringes of filler, be like, hey, could we do 2 today and sort of see how that goes and I can come back for others? Like you don't want to just hit it all at once. Even though we all want that instant gratification, that is not the result that gives you. That's not the way to get the best results. You have to get in there, learn the provider needs to learn you, and then you build on that, right? I like my patients 5 years after they've been seeing me to look 5 years younger than when we started. So I removed 10 years over a 5-year period of time without anyone noticing. That's the win.
You don't want to look like you've had something done, right? You want it to be subtle and to build on itself. And I love what you said about the Botox. I find the first time I'm doing someone's Botox, I will have them come back in 2 weeks because even though I have been doing this for decade plus, right? Everyone is a little bit different. And I find I sometimes just need that first visit to get a feel how they take it, how their forehead moves. Do they need more up here? Do they need less? And I'll usually just say, plan on coming back in 2 weeks so I can see how it sort of settles in. And then usually after that, we can just do it. But I do find that first time that I'm working with them, even though I know the anatomy and all that, there are little subtleties that I like to sort of follow up with. So I like that approach too. And yeah, a lot of times I'll say, if you think anything is uneven, come see me. A lot of times it takes 1 unit, 2 units to touch that up. And please don't walk around like that if you think something's uneven.
I don't want people being like, "Oh, Heather did this to me. Dr. Rogers did this to me." I'm like, "No, like if you're not even, I want to know, and I can do Botox on you for 10 years, and then one day you might be like, oh, hey, that's fine." Like I do the same. Usually have people come back at 2 weeks the first time I see them. After that, I'm like, you don't have to come back unless there's something that you want to show me. And if you want to show me, but you don't want to come back, then take a picture making the face, and you can show me at our next Botox visit or neuromodulator visit. I injected 80,000 units of neuromodulator last year. Like I do this all the time. I think I'm quite good at it, but you just need to have realistic expectations, both the doctor and the patient.
Again, we see these images on social media and celebrities, and we think that we're going to have these, like, everything's going to be perfect. It's going to fix all their problems and everything. So yeah, having those realistic expectations that this is what this procedure can do, this is what it can't do. And I really like to under promise and over deliver. I want to make sure I say that the right way.
No, if you've done it, you know that it isn't that easy. And the cosmetic consumer is very discerning and picky. And so you do not want to do something that causes more harm without the patient understanding, like, this is the path through, right? This is a conversation that we were having a little bit before we started, which is when you're talking to someone, there's sort of three things we have to think about. We have to say, okay, are you the right person for this procedure, right? Like, are you really going to freeze an actinic or a seborrheic keratosis on somebody whose skin pigments really easily or depigments really easily? Like, are you the right person for the procedure? Is the procedure performed correctly? And then is the person educated and able to take care of themselves after they leave your office during the healing period of time? And if you don't have commitment from the individual on all three of those steps, you're not going to be able to get those outstanding outcomes, which you and the patient both really want.
Yeah, because you're spending a lot of money and it's your face or your body, right? You want an improvement and you want to know. I mean, some of these things are thousands of dollars, right? So it's a commitment. So I love that approach. There's sort of three things to think about and see multiple people, especially for these bigger procedures. Don't just take the first consult that you get, or just because it worked for your friend or your neighbor, it doesn't necessarily mean it's the right thing for you or that it's the right provider for you.
Very much so.
I'd love to know, what are some of your favorite procedures for different skin concerns?
So my favorite procedure in general is the CO2 laser. I talk about it a lot. I do a lot of them. I post videos with before and afters. And I love the CO2 because I do think it helps with a number of different concerns. The CO2 is going to help with your fine lines and wrinkles. It's going to help with some of your deeper texture problems. So acne scars, big pores. It's also going to help with actinic damage. So brown spots. It's going to help clear up some of those pre-skin cancers. So it's a tool that can be used on a lot of different people to help with a lot of different things. I think we have, as a society, been like, no downtime. And in general, there are very few procedures with no downtime that actually do that much. And so people love the Fraxel, people love, BBL and IPL, and those all can help some with brown. But if you really want to build collagen, if you really want to help with acne scarring, you just need a stronger laser, and the stronger laser at higher settings is going to have downtime. And so in general, my patients, I CO2 laser their face, neck, and eyes every 3 to 5 years, just one. And it just cleans things up. And then we go to less strong lasers. We'll clear and brilliant for texture, brown, we'll IPL for red. And then 3 to 5 years later, we'll hit them again with the CO2. And that really does just slow the aging process without having a huge amount of downtime every year. But when you have that CO2, you will look puffy and disgusting for 4 days, and your skin will be raw and drying for a week. And you just got to prepare for it. But if you do a non-ablative resurfacing laser, you're going to have downtime that's 5 to 6 days. And the CO2 is 3 times, it's 3 times more effective. So it's 3 Fraxels each equal a CO2. So for myself and for the vast majority of my patients, it's actually easier to get a week once every 3 to 5 years than to get 15 days, 3 times 5, annually or or every 2 years. So that's like my number one. My number two, that at least in my office is just performed incredibly well, is M-Face. And it just really is a new technology that builds collagen, builds muscle in the face, and fights that jowl in a way that I haven't been able to get to even with the CO2, because it really lifts the mid-face. It adds volume to the mid-face. It removes a cc per side on your jowls and gives you a cc and a half per side in your cheeks without that widening that happens with filler. So the facial shape is really uniform and you look like you. I joke that it's a bra for the face, and it's expensive. But that is one where there's not much downtime. Your body has to do the work. I love procedures where your body has to do the work because I do think the outcomes are superior. Like my favorite filler is Sculptra. Like I really want to give the body direction, be like, hey, this is where we're trying to get to, and then support it as it's going in that direction. We're all going to lose the war. We're all going to age. Like this is just where it is. But those of us who are really battling on a regular basis, you see complications with too much foreign substance, too many procedures. And so whatever you can do to activate the body to do that work, be it PRP, be it Sculptra, things where like the risk of complications a little bit lower, the risk of inflammatory nodules, migration, occlusion. I feel like it makes it a safer, more successful path in maintaining your appearance instead of that generic, like puffy done appearance, which is not what we go for.
Well, we have Ellacor in my office, and I trained at Harvard with all the lasers out there, but we actually do not have any lasers in our practice right now. We tend to do more surgery and a lot of chemical peels, but I am a huge fan of Sculptra and love that. And I tell people it's playing the long game, right? It's not a quick in and out fix, but you will get amazing results if you can be patient. And it's even better if you can sort of start it before you really, really, really think you need it, right? Like a little bit, even in your early or mid 30s, depending on what your facial structure looks like, can be helpful. Now, I did not start that early. I wish I had the wherewithal to do that or the finances, right? But again, I think these little things along the way can make a big impact. And of course, I have to make a plug, right, for sun protection. If you do nothing else, protect your skin from the sun. I see patients, I'm sure you do too, right? Their stomach skin tends to be more sun protected. And then you compare that to their arms or their face. It's striking how simply just sun protecting can make such a big difference. And, that's really like the most affordable option, right?
No, for sure, right? And the data is 90% of aging comes from the sun. So you have to start with sunscreen, and it's more than sunscreen. Like my post today is, pay for the cabana because that's cheaper than fixing the skin, right? Like it's not just sunscreen, it's hats, it's sunglasses, it's not lying in the sun. That is incredibly powerful. And those of us who are fair learn that earlier, right? Like you get those sunburns as a youth and you're like, this sucks and I can't get tan anyways. But chronic sun exposure is a huge problem, and will slow the aging process. Ellacor, I mean, let's talk about Ellacor. Ellacor is really a
Yeah.
game changer in regards to I don't do like facelifts, I don't do neck lifts. I do Ellacor, and what I'll do is I'll Ellacor someone's lower face and then CO2 their neck the same day, right? Because I feel like I get some tightening with the CO2 on the neck. It's really hard to core well on the neck, particularly the lower
Yeah.
neck with the Ellacor, while you can get such beautiful coring on the mid face and lower face. And that combination together is wonderful. And I think people need to understand Ellacor is a disgusting, bloody mess for 48 hours. You really can put makeup on it and look normal
Yeah.
at day 4. It's makeup and there might be some bruising underneath there. But unlike the CO2 laser where there's that heat and actually like peeling of your skin, those holes close and you can put makeup on and roll. And that's great.
And nowadays, too, people are used to wearing masks. So you could just throw the mask on and people will think you're just, being extra cautious or you have a cold or something. So you could still run to the grocery or do an errand if you want. So I find the downtime for the kind of procedure and the results you get is really not bad at all. I mean, my chemical peels, that's a solid 7 days. Now you get beautiful results, but Ellacor, 4 days, and then you can cover the redness with makeup, or sometimes I'll do a light peel to even things out and help it blend. I do lower face and neck lifts, and I find that even with that, you still need to address the skin texture, and it doesn't ever get above the lip, those lines above the lip. So the Ellacor works great for that as well. I'm a big fan of it. I know some people shy away from it because if you YouTube it can look a little scary, but you are numb and you don't have the heat. I had a lady today actually come in and she was terrified of doing CO2 because of the heat, and the Ellacor, you don't have that sensation with it.
Very much so. And what do you have patients do after you Ellacor them? Like what do you have for their post-care?
So really, we keep it really, really simple. I just have them wash with a gentle cleanser and to apply Aquaphor. and I have them do the Aquaphor until those little channels close, those little pores, which I agree, it tends to be about 4 days. And then after that, they can resume more of their skincare. I still would caution against maybe doing tons of actives or their tretinoin or the retinols. I would say still keep their skincare pretty bland for that first week, but they can start using sunscreen and they can start wearing makeup. What about you?
Exactly. So I have a skincare line, and my ointment is a healing balm that is petroleum free and lanolin free. And so I have them put that on. We put it on before they leave, and then really that first day is just my face wash, which is 8-ingredient glycerin based gel face wash. All of the ingredients biodegrade. It feels amazing. So gentle face wash, healing balm. Do that really for the first 2 to 3 days. And like, if you're using my healing balm, if you're using Aquaphor, if you're using Vaseline, it's going to be sticky. Like, we want it to be sticky. We want to prevent that water loss.
Yeah.
And so you need an ointment on your face. Then really by day 4, I have them mixing the healing balm with the face cream to make it less sticky and less thick, and that they can put a nice layer on, put their makeup on, put their sunscreen on. I have them put on zinc-based sunscreen, ideally tinted, because that helps cover up the redness. Then any makeup they want to wear above that. And then they're good to go. And it is true, a lot of people find security with the mask, right? The being able to wear a mask just makes it so, particularly when you're only doing the lower face, it covers it up really nicely.
Do you find that patients need pain medicine afterwards, after Ellacor or other CO2 laser, things like that?
I don't. I think that there is significant pain during the procedure. And when we Ellacor and when we CO2, I give them Toradol, I give them laughing gas. We do tumescent, lidocaine for just do topical with CO2. And we get them comfortable. But what I think people are always surprised by is how little pain they're in the next day. Like, I always joke, it's more painful to look at you than how you're feeling. Like, looking in the mirror is painful. Making your husband look at you is painful. Your poor kids. But you're not in a lot of pain. And if you are, I want to know, because that's not typical.
Yeah, I totally agree. Yeah, usually that's a big question. Oh my gosh, how much pain am I going to be in the next day? And I'm like, really none. And to your point, like, it may not look pretty, and people might be like, oh my gosh, that looks painful, but it really isn't. And I find, maybe the night of some Tylenol or some ibuprofen, but really some ice that can help, right, if there's swelling. But yeah, pain afterwards is really not an issue.
I agree. And I think people are worried about the pain, and, it's smart to, I'm less worried about the pain. I'm more worried about that healing. I'm more worried about what happens a month after the procedure to make sure everything looks good. So I'm worried about the trips to Hawaii and the sun protection, because the pain is actually pretty easy to control and then goes away quite quickly. Much less so than with like Mohs surgery, right? When you do a big flap on someone's nose, they're very uncomfortable. That's not what we're seeing with these procedures.
Great point. And yeah, we just finished spring break for a lot of the schools here in Atlanta, and had a lady today, and she's like, I put sunscreen on, but she clearly was tan, had a tan line. So I love what you said too about sun protection is more than just sunscreen. That's just one component. And I'm a huge fan of like sun shirts and sitting in the shade, because no matter what, I mean, I do it too. Like, we never reapply it as well as we think we are as often. So yeah, if you are going to be doing these procedures, spending a lot of money, spending time healing, recovering, make sure to protect your investment with sun protection.
Exactly. And that's also something that the consumer needs to know, is that we can reverse what's happening up until the moment you leave the room, and then the aging process starts again. And people are like, well, how long does the results last? I'm like, well, how good are you about staying out of the sun, right? If you're good about staying out of the sun, the results are going to last a lot longer than if you're not. And that's not me being coy. It's just, I want to give people accurate results. The sun breaks down your collagen faster than anything else. And it brings back brown faster than anything else. So we can, make it so you don't have a single brown spot on your face. But if you're going to go be in the sun that weekend without a hat or sunscreen on, those brown spots are immediately going to start coming back.
Yeah, absolutely. Well, Dr. Rogers, this has been a lot of fun. I definitely know who I need to come see when I am ready to get my first laser procedure.
You don't need anything. So I'll see you in 10 years, lady.
Hey, I'll that works. But anyways, I would love for you to leave our listeners with just kind of like your top 3 tips for someone maybe thinking about getting a procedure. Where do they go next?
I think for getting a procedure, you want to go online and you want to read reviews and take it with a grain of salt. But I do think that someone with a lot of good or a lot of bad reviews is something you should make note of. You should talk to your friends who look normal. And that's really important, is that when you look at providers online, if their aesthetic, the way they look, doesn't speak to you, that shouldn't be the person you see. And there's those of us who look really natural. Those are those of us who look really done. And whatever is your aesthetic, choose a person who personifies that. And then don't rush into anything. You don't want to make sort of a quick, flippant decision with tattoos or with cosmetic procedures. You want to sit, you want to think about it, and you want it to be more exciting than scary. If you're scared, don't do it. You want to process it long enough where it really feels like a gift and a journey for yourself, not something that you're obligated to do or you're feeling forced to do or that you're scared of.
Such great tips. I know our listeners are going to want to follow you because you put out really great educational content on your social media platforms, or maybe come visit you as a patient. So can you tell the listeners where they can find you and follow you?
Yes. So my Instagram is at Dr. Heather Rogers. It's pretty easy, all one word. And my dermatology practice is Modern Dermatology in Seattle, Washington. And I'm there a lot.
All right. Well, I will definitely include that in the show notes so people can find you and follow you. And I really appreciate this. This has been a lot of fun. I've learned a ton.
Well, you've been wonderful to speak with. So thank you for having me.
All right. We'll see everyone next week. That's all I've got for this week's episode of the Skin Real podcast. But here's some great news. One of the most valuable things you can do to help me and other new potential listeners to find my show is for you to both rate this show and leave a review. So, as a special bonus for you, if you leave me a review, take a screenshot and email it to info@theskinreal.com, and I will send you a thank you free PDF on skincare truths versus hype, because I love spreading the word of good, truthful skincare. And please be sure to share with your skin friends so that we can get the word out there about real skin. And until next time, remember, no matter where you are in your skincare journey, always remember to love the skin you're in, because real skincare from real experts can be real simple.